Welcome to another episode of the Behaviour podcast. As always, I'm your host, Ben Rahman. On the podcast today, we have Dr. Han Ren. Welcome to the podcast, Han.
Hi, thank you so much for having me.
Excited to have this conversation. Before we get started, I just want to acknowledge that I'm producing this podcast in the lands of the Comox, Homoko, Kalehus, and Kla'aman First Nations. Yeah. So, Han, why don't you tell us a little bit about yourself, a bit of your kind of origin story. I wouldn't mind also hearing a little bit. I know we're not going to really be talking about, behavior analysis a lot on this podcast, but I didn't realize until you and I chatted for a while that you actually had some of your starts there. So I'd love to hear a bit about kind of how you started in ABA and why you left, and then kind of what that led you to do what you're doing now.
Yeah. So I am in Austin, Texas, in the States, also known as unceded Tonkawa Jumanos land. And I have a private practice here where I mostly work with overthinking overachievers, children of immigrants, and Asian Americans on racial identity formation, racial trauma, anxiety, perfectionism. And my practice is explicitly anti-racist and anti-oppressive and culturally humble in everything that we do and the systems and processes that we operate under within the practice itself, but also with our clients. And I did get my start in ABA as a freshman in undergrad. I was 17 years old,
Wow.
brand new to college, looking for a job, and found a position as an in-home behavior therapist. So got really, trained up in everything that was hot at the time. This was early 2000s when ABA was really hitting its heyday. So a lot of the Lovaas table time, Greenspan, Denver model, Gutstein, verbal behavior, all that good stuff. And I did that for my job all through my undergrad years, where I was an in-home behavior therapist, but I also worked in a hospital clinic. So I got to really work with a whole range of children and behaviors, all kids with autism. And then after I graduated, I joined Teach for America and was a pre-K special ed teacher. So really continued to apply my ABA roots in a classroom setting. And along the ways, there was just some things that kind of were really difficult for me to swallow. Just the hand over hand prompting, the extinction bursts, the lack of acknowledgement within the behavior analysis world at the time of other things that may influence behavior besides antecedents and environment.
Yeah.
And so it felt really reductionistic to me. And I got to see more of that when I was in the classroom, when I would try to apply these different frameworks to children's entire schedule throughout the day. It's one thing when you're sitting down with a kid at a table for hour or two and really getting your ABA session in, but it's another when you're trying to really make this work for the whole instructional day. And so that's why I kind of strayed from behavior roots and started incorporating other models, and decided to go back to grad school and learn even more about what makes people do the things that they do and how can we practice healing through a broader lens. And I think the field has, just continued to evolve since then when it comes to kind of divesting from some of the real strict roots of behavior analysis.
Yeah, although we definitely have a long way to go. So how did your training kind of continue then?
Yeah, so I got my doctorate in school psychology, and my program was joint school psychology and child clinical program. So most of my practicum experiences were in clinical settings, like acute psychiatric hospital. Did a lot of work in juvenile services. And so I got to really experience more of what it's like to work with kids and families that is not just bound by the school day. I did do my internship within a school system and found that to be pretty difficult to really adopt my values
Mm-hmm.
to the restrictions of the system that I was in. And so I really wanted to just have more autonomy. And that's why I started a private practice afterwards. But that experience also made me realize I can only truly practice good work in places where I am familiar and aligned with the dominant culture. Because I was really not aligned with the dominant culture in my internship um, space, and also experienced a lot of pretty consistent racism and digs at me because of who I am. So all of that really informed my current frameworks and my attachment and commitment to liberation psychology.
Yeah, I want to get into that in a second. The
Mm.
the school psych piece, I hear you about sort of all those issues. I've had a few school psychs on now, and
Mhm.
it seems to, and generally they've been mostly people from sort of more the kind of global majority backgrounds, and it seems that they're all working on trying to change the systems there and the structures there, because the school systems, and most of the systems we have sort of in the Western world, but are really not conducive to diversity and sort of all those things. And so a lot of these folks find that they have issues with recruitment and retention. They have issues getting folks to take the school programs in the first place. They have issues, keeping folks in the workplace, because they often come to the workplace and end up sort of being expected to then do all of the, anti-racism work on their own, even though all of the racism is directed towards them, because they're often the only person of color in that setting. And so I love having these folks on, because they're really passionate about, doing that sort of decolonizing type of work. But yeah, it definitely takes the right kind of person.
Yeah, and it takes such a toll on the individual. And I think, one of my favorite things about being in liberation spaces is the emphasis on rest and joy and pleasure and celebration, because it's not an option. It's a necessity if we're going to sustain ourselves
Mm,
and continue to take care of ourselves so we can, do this work from the inside and not burn out.
yeah, yeah. So let's. I've had one guest on so far, Dr. Evan Auguste, who was talking about kind of Black liberation psychology. But uh, to be honest, he was just full of so much wisdom that I spent a good chunk of the interview just being in awe of his brilliance, and maybe didn't sort of assimilate some of the concepts as well. So I was wondering, what is liberation psychology? Can you tell me a little bit about what that even means?
Yeah. So liberation psychology is psychology for the oppressed by the oppressed. So
Mm,
it really challenges the traditional Western based views by giving a voice to the origins of healing. And it's emancipatory. It is an empowering approach, and the principles really goes beyond just like the individual biopsychosocial model of what makes a person struggle with their psychological issues or the mental health. It
mm,
really links the personal with the political, with the macro and the environment. So it really takes into context these systems of oppression that we're all under, and we are also really working to co-create and deconstruct the hierarchy within the therapy room. So as a therapist, we tend to have more power, but in a liberation model, we think of ourselves as collaborators, and there's more use of self-disclosure and more acknowledgement of the mutual humanity that we are both living under and trying to survive and fight against. So it is inherently a very political way of practicing. But I think given where the world is and given how these systems of oppression are affecting everybody, and you can literally see it, it's
mm.
becoming more and more necessary to unpack and dismantle some of the roots of psychology that just does not serve everybody, especially not people with marginalized identities.
So, I mean, when I had Dr. August on, he was talking a lot about uh, an article he did with couple other folks on sort of the history of anti-blackness and racism in psychology going back like 50 years, and going all the way back to sort of even the idea of the founding fathers, and of sort of a lot of these fields are generally all kind of white presenting cis men, but also everything from experimentation, on marginalized groups to exclusion of marginalized groups in research studies. I know one example that he brought up a few times was sort of the idea of they did all the research on finding out the problems on marginalized folks, but then did all the research on solving the problems on white folks.
Yeah. Yeah,
And
it's only white folks get the privilege and the access to solutions like that.
so is is liberation psychology then like its own field? Like how does how is it kind of practiced? How does it sort of fall into your world, or is it just, or is it a philosophy? Like how do we use it?
I think of it as like a theoretical framework. It was founded in the early 80s, really has its roots in Latin America,
Mm,
because of all of the civil wars and the necessity of empowering the oppressed in that time and space. So the founder of it is Ignacio Martin Barro, and
mm,
it's right around the time like Paulo Freire's work, and so it's been around for a while. But I think in North American Eurocentric views, it's not a framework that has really been given that much consideration until maybe in the past. I mean, I really noticed it in the US after Trump was elected, when like all of the more covert sentiments came out of the woodworks, and it was just very overt, and people of the global majority were feeling the lack of safety just by existing, and then finding that, okay, maybe it's not helpful to me to challenge your cognitive distortions, and CBT might feel a little gaslighting to say, is it all in your head, and what evidence do
mm.
you have that people are enacting racism against you, right? Like, so it was really a practice that I was utilizing before I even knew there was like a word to it. But when I started my practice and noticed like, oh my gosh, we have to really expand on our healing models to talk about these political structures that are happening, that are influencing day-to-day life, these current events, all of that, and not just influencing my client's life, but my own life as a marginalized person. And so being able to really expand on that in the past decade or so, I'm seeing so much more just discourse around it and more acknowledgement of the need to practice from this framework in other ways. I think of it as a lens, right? This is not a replacement for interventions or other theoretical orientations, but it is a lens through which you apply your existing Eurocentric healing frameworks.
Right. And so is there, I mean, it's been around since the 80s now. Is there some training now sort of that, I mean, I know there's work that you're doing and others are doing to sort of, help folks that have already been trained kind of decolonize and kind of reshift. But is there training for like students and whatnot in sort of this area now, or?
Yeah, I mean, there are a few doctoral programs in the States that really focus on community liberation and
Mm,
eco-psychology. And like the current APA president, Dr. Tima Bryant, is a liberation
right.
psychologist, Black woman. There's been several textbooks that have been out, like that have been scholarly texts on liberation psychology. And then just like the canon works of the early thought leaders that we've been able to build on. It's very much rooted in Black and brown liberation works and like queer feminist works, that we have been able to apply a lot of these early theories to psychological practice and intervention. So there's definitely a shift in tides, and I'm getting universities that reach out to me to do more speaking, and then people sending me syllabi that they're teaching on liberation psychology or
Mm,
decolonizing mental health, which is super exciting because that's not at all what I was trained in, and
mm,
that's not something we even heard of when I was going through grad school. But I think it takes a long time to turn a huge ship. there's still, despite the content that is being taught, a lot of these programs are housed in predominantly white institutions
Right.
where the systems, practices, policies, processes are still going to be very traditional and adhere and uphold existing systems of power. And I think that's really where the challenge comes from, because these are the places that are accredited and they're able to, provide the education because of their existing infrastructure. And yet,
Mm.
so much of this requires a radical, like, dismantling of how things are taught.
Yeah, yeah. I've heard you talk about, I don't know if this is related, but collective liberation. Now, what's
Mhm.
that mean, and kind of related to the liberation psychology and so on?
Yeah, so it's the idea that you can't fight for one cause, like one marginalized cause, without
Mm.
fighting for all the other marginalized
Hmm.
causes. So, like, a lot of people, or a lot of women, are very feminist and they're very pro-feminist, but then they're like, okay, but not trans people, right? They get very turfy or swerfy. There's always exceptions to the liberation or the radical um types of, like, who they're fighting for.
Sure.
And the idea of collective liberation is that rising tides raises all ships. You can't say, like, okay, we want to promote Black
Mm.
liberation but not Asian liberation, or vice versa. And so much of our existing liberation, anti-oppressive frameworks tend to focus on one domain. And sure, we all have
Mm.
specialties in some areas, and not others, but it can't be considered like a zero sum game, like, help my people, but your people have to continue to suffer, because that is
Mm.
a ploy of white supremacy. As Audre Lorde said, you can't dismantle the master's house with the master's tools. So we have to really consider and reimagine ways to do this that are empowering to everybody. One group is not going to thrive at the expense of another. That is not actually going to be sustainable, and it's not true liberation.
Mm. And it sounds awesome. I know something I hear a lot arguing. I'm vegan, and so I'm often in these kind of animal rights circles and protest circles, and often something I've learned is recently is that there are vegans across the board, from
Mhm.
far left to far right, as much as we believe they're all dreadlocked hippies. Their opinions are very interesting.
Yeah.
And one message I constantly hear from sort of the animal rights protest group is that you shouldn't be talking about race, you shouldn't be talking about the other things. We should just be protesting for animal rights. Very, very kind of one kind of singular thing. At the same time, then we also hear, and I know 100% this is not what you're talking about, but I could totally see someone comparing what you're saying to sort of the Black Lives Matter, All Lives Matter conversation, and someone going, well, you're saying what I'm saying, Han, that all lives matter. And so how do you kind of navigate that? Because I get what you're saying, that we definitely want to, we can't just be like, against anti-black racism but pro-Asian hate. That just doesn't make any
Right.
sense.
Mhm.
But how does one navigate that so they don't have to become, sort of a protester slash social justice champion for everything everywhere?
Yeah, I mean, obviously, we all have our lanes, and we get really good at our lanes. And if we stay in our lanes, that is still, contributing to the collective good and the collective shift in tides. Um,
Mm.
and at the same time, acknowledging and becoming co-conspirators and collaborators with people who, in their respective lanes, is part of this coalition building, this
Mm.
reimagining of systems, this community building. And when you're thinking about, who is included in this, you don't want to include people who already have power, or like beings, right? Like, when you're talking about the animal rights people, it's not like, well, you know what, human beings are also animals. So,
Hmm.
like, can we focus on, I mean, I don't think cannibalism is a huge issue, as
It
far as I
comes
know.
up.
I'm sure it comes up. But it's I can see, like, in that cause, like, okay, maybe, when we're focused on animals because they're the ones who are stripped of power, right?
Mm,
But when you say like Black Lives Matter, it's because Black people are the ones who are most oppressed and marginalized. You
mm-hmm,
don't need to say, white lives matter, because there's not
mm-hmm,
a problem with
mm-hmm.
indiscriminate white death by the hands of um, people in power. So
Exactly.
yeah, so you really have to do a power and structural analysis when it comes to these issues. And, part of saying, okay, collective liberation is really also taking into account the marginalized intersectional identities that people hold. People rarely just hold one feature. And the more
Mm,
intersectionalities that a person's identities are in, the more likely they would want to fight for collective liberation, because it affects so many different aspects of
mm,
life and self, versus people who are like white women. Like, okay, I get why white feminism is really important to them, because that is the only area that of oppression that they really, really experience viscerally and personally.
mm,
Um, and yet, if that's the only cause that they're championing for, then it really is not feminist at all, because you're ignoring, all the women of uh,
mm.
different origins.
Yeah, yeah. Well, that reminded me of a reel I saw you do
Mm,
where you were comparing. I loved it around the sort of the gun lobby argument around mental illness being the cause of sort of all these problems, but yet those same folks don't fund any mental health initiatives.
exactly. Exactly. Yeah. It's like, okay, so which is it, right? Like, if it's not guns, it's mental health. Okay, then what are we going to do to support mental health,
Hmm.
and do that in a ways that's preventative and proactive, and not, reactive and waiting for people to fail or die. And if you think about mental health justice in that way, it's not like psychotherapy, it's housing and healthcare and
Mm,
universal basic income, and all these elements that allow people to live so they have the luxury of even considering something like mental health.
absolutely. Yeah. So go back to your definition about how liberation psychology is by the oppressed for the oppressed.
Mm.
So where do sort of the co-conspirators, co-collaborators kind of fit in there? Like I obviously based on that definition, I can't practice liberation psychology.
Oh, but you
So
absolutely can.
okay.
Yeah, because just because the model was founded by that framework, it
Mm.
doesn't mean that, other people can't join and amplify.
If you're planning on collecting continuing education credits for this episode, you'll need to enter the 3 secret words at www.cbiconsultants.com/shop. The first secret word is liberation.
Right? It
Mm.
just means maybe you don't get to lead, you don't get to like create new, theory in this field, because
Right.
it's not something you have lived experience around. Like, liberation psychology very much honors and centers lived experience alongside professional experience,
Mm.
whereas more Western Eurocentric models center professional experience and tells people, like, don't even share your lived experience. It might make you seem less professional. And so, it just means that you amplify existing voices, you support people who are doing this work from an activist lived experience perspective, and you help them do what they say needs to be done next. You take your charges and let them take the lead, rather than trying to spearhead something that you are in theory behind but don't have personal experience with.
So liberation psychology should really just be the way we all approach psychology.
I mean, I think so, but it's not everyone is comfortable with that. And I get it, because it's
Mm.
really, really hard to unlearn all that we know about what professionalism requires, and what, blank slate psychotherapists should be. And
Yes.
a lot of it is challenging those existing notions of, what it means to be a therapist.
Yeah. I want to talk, just going back to a bit about your history again, because you talk a lot on your Instagram about how your own sort of experiences and intersectionalities and identities really kind of guide your practice and why those kinds of areas. Like I know you talked about how you do things around sort of overachievers and perfectionists, and then you've talked about how that maybe still is, but used to be a way you often were, and so that's kind of why you do that kind of work. And once you talk about working with Asian immigrants, and obviously there's some history there. So I'm just curious about sort of whatever you're sort of comfortable to share about your own history that kind of guided the work you're doing now.
Yeah. I mean, we hear about this in academia, right? Like when research becomes me search.
Hmm.
And I think this is absolutely true for therapists as well. Like when you think about why people are drawn to this field, a lot of us like want to help others. But if people are truly honest, a lot of times it's also because we're trying to help ourselves, help our
Hmm.
families. We've
Hmm.
experienced personal difficulties related to mental health because of maybe what we couldn't access or what our loved ones couldn't access. And so there's something that really is, compelling about wanting to heal others, or heal yourself through healing others. And I think that is absolutely a, foundational place from which I practice. I do the best work with people that I can relate to more personally, whose experiences I have been able to bear witness to in my life,
Hmm.
in my personal and my professional lives. So a lot of how I practice is informed by that, and it keeps growing. It really started off as just like, okay, Asian American identity and being a woman, right? This is what you can see. And
Hmm.
then from
Hmm.
there, it was a lot of like, okay, went through 27 years of school. So bit of an overachiever here,
Hmm.
probably a little neurotic and anxious and perfectionistic as well. Like, how do I help other people who are experiencing and living that? And then,
Hmm.
more recently, it's extended to ways that I identify in my sexual orientation as well. Like, I identify
Hmm.
as a woman. I am non-monogamous. Like, these are
Hmm.
elements that I have felt a lot of shame around for most
Hmm.
of my life and tried to
Hmm.
really mask and hide, and realizing, you know, these are elements that a lot of therapists are dealing with, a lot of people
Hmm.
are dealing with, and it doesn't help anyone to pretend that they're not part of who I am. It's that old saying, what you resist persists.
Yeah. You came out on Instagram a while
Mhm.
back, which is
Yeah.
awesome. Good for you. That's amazing. And I'm wondering, how did that sort of did that change your practice? Did you now start getting more kind of clients that were kind of identifying there, or were you already and you were sort of maybe came out in confidence in some of those sessions? How did that kind of change your practice when you came out?
I'm not accepting new clients, so I
Hmm.
haven't really seen a shift in my
Right.
referrals, although I'm quite positive based on just how I've witnessed in my personal community of how difficult it really is to find
Hmm.
queer polyamory affirming therapists.
Yeah.
There's just a lot of mononormativity and compulsory monogamy and heteronormativity in
Hmm.
our society that people aren't even aware of needing to dismantle.
Hmm.
And so I haven't been able to see firsthand how that would affect my referral streams, but I will say that a big motivator to sharing that was just the conflict I felt around having the social location and positionality of privilege of being in a straight presenting marriage that,
Hmm.
by all intents and purposes, like two people with a mortgage and two children
Yep.
seems very monogamous. Like all of these elements that allowed me to have the protection and safety and access of that privilege, although I myself and my identities did not identify in that way. And that
Hmm.
creates a lot of dissonance. And as an anti-oppressive educator, I do feel like it's really important to be, acknowledging of all the different facets of my own identity. Certainly
Hmm.
can't speak to being a champion for other people's struggles that I don't have lived experience around. But
Yeah.
why is it so important for me to, promote equity around racial justice just because people can see it, but then not
Yeah.
around other marginalized parts of who I am?
Yeah. Do you mind if I ask a couple questions about polyamory? Just because
Sure, go for it.
I
Yeah.
know nothing about it. So
Mhm.
because I won't lie. I mean, I immediately had some of those biases and judgments right away
Oh,
too. I mean, you've talked about your husband a lot, and he sounds super awesome, and your kids sound great, and your dogs sound awesome. But it certainly just sounds like you know, my colonialist biased perception of what a family should look like. Um, I would, add more bias. I already have assumptions on what I think your husband should look like too, right?
mhm. Sure.
Based
Yep.
on some of that. And so I'm sure it sounds like you've had a lot of great support since you've come out, which has been awesome. But it sounds like there's been a lot of nasty stuff too, and I imagine some of that's related to your situation, because it would be really easy for my very skewed. I'm going to start asking some questions in a second, but
Yeah.
my very skewed perspective of polyamory, um, primarily because, in particular, because I live in British Columbia, and so we hear a lot about polygamy here,
Mhm,
which
mhm.
The words are even similar, and so
Right, right,
it's
but very
easy in my
different
yeah, so it's
conceptually.
easy in my
Yeah.
brain to connect those together,
Uh-huh, uh-huh.
and suddenly get super judgmental,
Right.
which is interesting that you pointed out in one of your posts, that it's folks like me that seem to be most bothered by this concept, white men, and so I wonder if you could just tell us a little bit about what that even means, because I think
Yeah.
it doesn't mean what I think it means.
Yeah. Yeah. So, I mean, polyamory just means multiple loves. It is
Mm,
the mutual consensual decision to be able to explore multiple romantic relationships.
mm,
That's it. And
yeah.
how it looks, the logistics, the relationship agreements and guidelines, all of that are so diverse and varied depending
Mm,
on the people who are involved in it. And there's a
mm,
whole spectrum of what that looks like. And it's there's no one prescriptive thing that
right.
it is. Sometimes it's only sex, sometimes there's no sex, sometimes it's romance, sometimes not romance, sometimes it's just doing life together. There's on one extreme relationship anarchy where every single relationship, romantic, platonic, family, or whatever, is considered equally as important, and you're
Mm,
not privileging one relationship over the other by its inherent structure.
mm,
So there's just such a diversity and range of what it looks like to practice this, and what it means to people, and what draws people to this, and why people live like this.
mm. And is there a sort of a cultural kind of history there too? Because I sort of imagine that, again, my Western colonized brain wants to frame it in a certain way, because this is the way I've been taught to believe relationships should go. Like, are there cultures where polyamory is happens all the time, and it's just sort of a normal thing, or is it across different cultures? Like, how's that play?
Yeah. And, when you think about modern times, like
Mm,
everything is kind of influenced by colonialism,
yeah.
Christianity,
Yep.
imperialism. It's like really hard to like say that for modern times. Like historically, we
Mm,
have had a lot of more collectivist, community building, matriarchal
right.
communities and societies. But in modern day, it's really hard to tease out the patriarchy from it, which is
Mm,
probably part of what in this where this bias comes from, because so much of this historically has been rooted in like a man wanting to control multiple women, taking on multiple wives, but
mm,
they don't have agency to do the same. And it is like a radical form of patriarchy and control.
mm,
And that is not at all the theory or ideology behind, more modern ways of practicing polyamory. It's about consensual, intentional relationship agreements, whatever that may be. And, at the end of the day, like polyamory and intentional monogamy are very similar. Like you and I both want the same things, and this is how we want it. And we talk about it and we agree to uphold these relationship agreements that we arrived at together. And if things change, we'll discuss it. And, whether you're monogamous or not, that's ideally how all relationships should be built upon.
And of course, it could also, and obviously it can mean anything, but I think the term poly also makes you sort of assume hundreds of people, or whatever, or like all the time, everyone I've met, I'm in love with, or whatever.
Right.
And those are the things. And poly can just be two people,
Right. Or you could be, polyamorous in like your identity, right? Like it could be something that's more of a political stance or a personal stance. Like I want the option. Like this is something that I always want to have the option, or I sometimes want the option to. Like right now, life is happening and we are choosing to not do that, right? It doesn't have to be, something that is constantly practiced in order to be part of who you are. So, there's really just different facets to it, because it doesn't have to be something you're constantly actively doing to identify with.
Yeah. And I like the idea of just having an option. I had a great conversation a while back with someone on kind of gender fluidity and sort of as a construct and gender as a construct, and the idea that, you should just be able to move back and forth in any kind of direction you want at any time, because it, just I might just today just feel like painting my nails. And it's not because I'm, less or more of me or anything else. It's just I just want to paint my nails, and that's just a thing, or I just want to, do this or do that. But because they don't fit into sort of our Western constructs of male, female, and so on and so forth, therefore I'm doing something wrong. Wherein I'm just doing what makes me feel good, and that's kind of what you're saying.
Yeah, it's breaking out of binaries and dualities with communication and intentionality. Because you asked about polyamory, and I will pivot that to say non-monogamy, right? Non-monogamy is pervasive around the world. Everybody's doing it. Not everybody, but every single culture has lots of people doing it. It's just non-consensual. It's just underground, right? And, somehow like that seems to be more acceptable, and like just, and you just don't talk about it. You turn a blind eye to it in some cultures. Like, well, that's just how men are, right? And it's like, why? Why is that okay? And why is that normalized and not the intentional communicated choice and conversation around it?
So that's the difference. Of non-monogamy is basically cheating. And
I mean, it's just multiple partners. In whatever way, right? It can be, it can be physical, it can be sexual, it can be whatever ways. Just being involved in multiple people in ways that you and whomever you're with decide is more intimate than what you would typically do. And it can be consensual and ethical and, above board, or it could be non-consensual, which is cheating.
And so going back, and obviously not the same, what's sort of the difference then between polyamory and polygamy for those that are hearing the two words and going, they really sound the same?
Yeah. Okay. So non-monogamy and polyamory are, non-monogamy is the bigger umbrella, and polyamory is one facet of it, where people want relationships. It's not just sex or not just one element. It's like everything that comes along with relationships. And then polyamory and polygamy is the practice of marrying multiple people. And the places where that is allowed tend to be more patriarchal, and, it's only allowed in one way, right? Like harems or sister wives or whatever. And so there is more of a flavor of non-consent by some people involved, or not like, maybe not completely informed consent, but certainly not equal power. There's definitely more power over in how these partnerships are constructed. So anytime saying like, well, I'm allowed to do this, but you're not, then you're not, that's not polyamory.
Hey, gotcha.
Yeah. Which is different than like, I'm allowed to do this, you're allowed to do this, but maybe you don't want to do this. And you say like, okay, cool, you do that, but I choose to just be in this because I don't want to have all of these other things. That's different. That's still consensual. That's still the option for it to be practiced if, people want.
Got it. Okay, no, good. I'm glad to clear that up, because I mean, it's probably a question you're answering a lot now that you've talked about it.
Yeah, I think, it's interesting because part of my comfort level in sharing this is also shaped by kind of the cultural zeitgeist around this. Like,
Mm,
it's something that I've been seeing a lot more in my practice. I've been seeing a lot more on social media, just like, especially after people were quarantined with like one person and they're like, oh my gosh, like, this is a whole lot. Like, more and more people are opening up or just considering this as a possibility when they approach romantic relationships in general.
gotcha. I also see in your bio some neurodivergence as well.
Mhm.
What's that about?
There's a big overlap, I think, in like
Mm,
the non-monogamy and the neurodivergence community, because it's
mm-hmm.
kind of like, outside the box thinkers, right?
Yes.
So I grew up with a lot of attachment disruptions and have a complex trauma history,
Mm,
and then I was also diagnosed with ADHD as an adult.
mm,
So that definitely fuels my energy levels, the way that I look at myself and the world around me, and really my executive functioning as well.
yeah. Is that a recent? So that's a recent diagnosis?
It's not, I've more recently started talking about it. I was diagnosed with this when I was 24, when I started grad
Mm,
school. And I had a lot of imposter syndrome around it of like, oh gosh, maybe I fooled my psychiatrist, or, not wanting to really believe in that diagnosis, but then also like finding like medications and just routine and structure to be incredibly helpful for living my life. And it's not until I would say the past decade where there's so much more research and just conversation around how this shows up in women, how this shows up in adults, and in Asian women, or women of the global majority, especially. It just does not show up the same way as it does in the 7-year-old white boy. So now that I'm getting so many more examples and stories and community around it, it's been really reaffirming, and also feel safer to be able to share my experiences
mm.
around living and growing up with this.
Yeah. No, I had my ADHD diagnosis just a few years ago in my
Mhm.
40s,
Yeah.
and yeah, certainly explains most of my life and a lot of my childhood and a lot of the issues that were kind of happening there. And so yeah, it's been amazing, and the adult diagnosis has just been a wonderful change. And the medication, I used to be so anti-medication until I tried medication for ADHD, and it's yeah, game changer, 100%.
Yeah, totally. And also just the normalization, right? You don't have
Mm,
to, shame yourself of like, why can't I do this the way that other people do it? And it
hmm.
allows you permission to really like work with how this affects your life rather than like pushing against and trying to fit back into a box.
Yeah. Curious, just while I have you here, do you have any strategies yourself for kind of something I've been noting just doing this podcast is, and I mentioned it when I talked about Dr. Auguste coming on, and I forgot everything he talked about related to Black liberation psychology, and so I was looking forward to a bit of a refresher with you about sort of how to retain information from sort of long conversations. Do you have any tools yourself that you use, or is that an
Mm.
issue for you? The second secret word is model.
Gosh, no, I mean, it's definitely an issue for me, but I remember like the weirdest things. Like, I
Mm.
have such an uncanny memory for things that aren't really necessarily helpful. Um,
Same.
yeah, I mean, I think a lot of it's repetition. This
Mm.
is this is maybe more of a life self-soothing strategy.
Yeah.
I trust that if it's important, it will show back up in my life in some way.
Yeah.
And it almost inevitably always does.
Yeah.
And so over time, it's like, okay, here I am noticing patterns, right? That's like an ADHD superpowers. You notice all of these patterns in these different
Right.
ways and spaces. And then I'm able to pull things together more readily that way. I may not be able to have like that explicit recall, but I have really good recognition. So if I hear something or learn about something, and even if I don't like remember the details of it, when it comes up again, I'm like, ah, yes, that. And then I can like, connect the dots in my head more readily. And
Mm.
that helps me with the recall and the retention piece. And then also just writing down a lot of notes. I don't even read my notes. I never
Yeah.
go back to read anything I write, but just writing it down really helps me to consolidate information. And also just like making these TikToks and reels, like it's
Yeah.
fun, it's informative and educational, but it's also one of the big ways that I process information for myself
Mm.
and how I consolidate and make sense of, patterns and trends that I see in the world.
I love that. I love that. I love the idea that it'll come back to me eventually when I need it. I think for the most part, you're right. It kind of has done that. So I feel a little less, I don't know, um, useless because I don't remember all the details.
Yeah, just relieve that pressure, It's
Yeah.
it's it's not necessary unless you like have a test on it or something.
No, exactly. Well, and the other side of the coin is I also know I have pressed record on all these interviews. So if I really want to know, I can go back and listen. Uh, and sure, and funny enough, I never go back and listen.
There you go.
um, Wondering about your work because there's something we talked about in kind of our pre-chat that I wanted to learn more about is just your work with the Asian community. So you do a lot of work with Asian immigrants, and can you tell me a bit about what that work's about, what that looks like?
Yeah. So mental health is something that's pretty stigmatized in my community.
Mm.
And if you think about what happened in the whole continent of Asia in the 20th century, like every single part was touched by some form of systemic trauma, whether it's, the Cultural Revolution of China, the Korean War, the Vietnam War,
Mm.
World War II in Japan, and, everywhere that Japan touched during that time, British
True.
colonization in India, the Cambodian
Yeah.
genocide, right? It's just like this whole continent was racked by systemic trauma.
Mm.
And so many people had to, flee, creating this Asian diaspora.
Mm.
And they were very much focused on survival. So then they go to these different places, have children, and then they're raising them based on these kind of survival traumatized strategies. And then the kids are growing up not finding as much integration or confidence or happiness.
Mm.
So that's really my area of specialties is people who identify more as children of immigrants or like, 1.5 generation immigrants, people who are third culture kids who are navigating bicultural integration and racial identity formation issues. And
Mm.
then, put on top of that, the just overall racism that exists in the US, but actually everywhere in the world, and the colorism, right? There's definitely themes of that everywhere you look. Just some
Mm.
places are better at talking about it than others. So I help people kind of make sense of their identities and their values and how these different parts of themselves fit together to make them who they are. A
Mm.
lot of people who come and see me have checked off the boxes. They've reached these goals on paper and
Mm.
they're, quote unquote successful, but they're not happy. They're not content. They don't feel fulfilled in their lives. And it's so confusing because so much of our upbringing is like, well, if you just, go to college, get a good job, get
Mm.
married, you reach these life milestones, then you will automatically be happy. And if you're spending so much time trying to live up to these external expectations and validation points, you're not really exploring what it is that you want for yourself.
Mm.
And so a lot of times people don't arrive to a place where they're able to explore that until their young adulthood. And then that's what I help people try to unpack and navigate.
Mm. So you talk about sort of racial trauma and identity. What is racial trauma? Is it just essentially experiencing racism and all the things that kind of come with that, or?
Yeah, yeah. I mean, we think about it as like, oh, you have been like the victim of a hate crime, right? Like that is certainly racial trauma,
Sure.
and it's in an extreme form. But
Right.
a lot of this also takes the form of vicarious trauma. When you're seeing in the news people who look like you be brutalized and killed,
Mm,
harmed time over time, or like even if it's not by human factors, it's more like environmental context, or even like natural disasters, like the wildfires in Hawaii, like
mm,
a lot of the people who are missing are Native Hawaiians, Filipina,
yes.
Mexican, they're immigrants. They're people who work at these resorts to serve the tourists, right?
Mm,
So, when you're seeing the ways that society treats people who look like you and who have beginnings like you, there's either a tendency to really want to separate yourself from that. Well, I'm
mm,
different, which then perpetuates supremacy culture, and you kind of buy into this more dominant narrative, or you have this over identification with them, and then that can lead to a lot of survivor's guilt, imposter syndrome, and depending on where people are, it's always some form of reckoning. And how do you stay engaged enough to contribute and help the cause, but also protect yourself and get a clear sense of who you are as informed by these experiences, but not defined by them.
mm. And would it be safe to say that a lot of folks may not be aware that they've been traumatized by this, or?
Sure. Yeah. I think a lot of times people come in and they're just like, I'm depressed or I'm anxious. Like those are the two, tip of the iceberg symptoms that
Mm,
people tend to come in with. And okay, so let's do some coping and skills building and, talk through some of that. And, for some people that's good enough. But I think when people really start digging into the roots of why and how, what do I do about it? That's where it gets messier and
mm,
deeper. And that's where, elements of who you are and where you came from and where you learned these things absolutely do play a role. We all learned our values from somewhere. And how can systemic trauma and, oppression not influence the values that we do hold?
mm, mm. I've heard someone talk about approaching things less from a trauma informed lens and more from a trauma assumed lens, because and there's been some arguments against it, like not everyone's had trauma, but it does seem like, and I don't know if there's research around it, but it does seem like everyone has had trauma. Is that?
I mean, trauma's subjective, right?
Yeah.
Like it's too much, too fast, too soon.
Mm,
It's too alone. Like you can go through some really, really hard, disruptive, injected things in life, but you have a strong support system. You are able to talk about it
mm,
with people in ways that are affirming and not shaming. And then it doesn't get encoded as trauma. So, a lot of times people experience like relatively small, misattunements or things in their lives, but they felt so alone and they
mm,
didn't have a place to put it. And then that shame over time becomes toxic. And then that does become encoded as trauma and informs how they approach future similar events.
mm.
And it really is such a subjective experience that you can't really say one way or the other that like everyone has or hasn't. I think
Right.
a lot of people have. I think if you think about trauma as more of the subjective, too much, too soon, too fast, too alone perspective, then it does encompass a lot more than what we, typically assume about trauma, as in capital T trauma.
Mm. Well, and I think, and then there's also an assumption that, and maybe this is self-inflicted, that I shouldn't try to deal with my trauma unless I've got like a disorder, like I've got
Mhm.
PTSD or something.
Yeah. I mean, and that's the narrow limitations of, modern categorization systems, right?
Mm,
That's the drawbacks of the DSM, that you have to like check these boxes in order to receive help. Maybe, and I would say like probably even most people who have experienced some form of trauma don't live with a trauma disorder in that sense. You know, it's not super disruptive to their day-to-day lives or, you know, causing major distress, but does it influence how they approach relationships or parenting or money or work or joy or anger,
Mm,
right? Like, does it influence how they view themselves and others? Absolutely. And so maybe it's not so disruptive that you know, qualify as having a disorder, but does that warrant attention and care
mm,
and time and energy so you can live with more ease? I mean, I think so.
mhm. So, wondering about this phrase, just kind of related to the Asian piece. You talked about this idea of model minority Asians. What's that mean? What's that about?
Well, the model minority myth is all the stereotypes that you hear about Asian Americans. We're good at
Mm,
math, we are high achievers, we make more money, we're more educated.
yes.
You know, so it's all the like biases and stereotypes about being Asian in North America that
Hmm,
people think like, well, that's not actually a detriment to you because it's a
right.
good stereotype to have. But it's also a lot of pressure, a lot of expectation. It's also very much reductionistic of the Asian community.
Hmm,
There tends to be a lot of variance in how people in this community, you know, achieve or, you know, perform. And, you know, just like there is in every community, no community is a monolith. um and so the model minority myth was really created, you know, and in the 1960s during the American Civil Rights Movement, where like Asian American was even created as a racial identity, you know, specifically to perpetuate anti-blackness. Because if we have multiple groups of minority people and then there's some who are doing, you know, quote unquote so much better than another, then maybe it's not the system that's broken. We don't have to address the roots in the system. It's, you know, the individuals who can't perform or achieve as well. So it really, model minority is designed to perpetuate anti-blackness and say, you know, look at those people, they seem to be just fine under current policy, so we don't need to do anything. It's something wrong with you, that's the
hmm.
problem.
And do your clients that are maybe experiencing this, do people, or just in general, do people try to live up to that?
Oh yeah. Oh, certainly. There's so much pressure, you know, and
Hmm,
it's something that's very much internalized and perpetuated by our parents' generation too,
hmm,
because they have immigrated, they have, you know, sacrificed everything to give us a better life. So we better live up to that. And
hmm,
it's true. They really have sacrificed so much, and they um, prioritize and value education so much because it feels like such a meal ticket out. But sometimes that's at the expense of social emotional health, relational health, physical health. You know, all these other elements that make a person well balanced and well rounded.
hmm. And so is this then for you part of the reason why at one point, and maybe still now, you were identifying as an overachiever? Is that sort of part of
Oh
that?
yeah, absolutely. Yeah, yeah. There was you know, growing up in a pretty traditional Chinese household, it was the expectation was to make straight A's and go to college and get a graduate degree, but not any graduate degree. It had to be some
Hmm,
sort of doctorate. Like I had a lot of high expectations that I felt a lot of pressure to live up to. And so, you know, a big cost to that was sense of self and being able to explore things that I actually wanted to do, or even knowing what I
hmm,
actually wanted to do. I was in such a rush in my 20s to just like hit the next milestone, just check the next box. But at a certain point, I like checked all the boxes and I'm like, well, now what? I still have the majority of my life to live. And I
hmm.
don't know what makes me happy. And I don't know
Yeah.
how I want to live with that time.
And yet there's an expectation for you to work, make more money, and so on and so forth.
That internalized capitalism, that, you know, emphasis on productivity and achievement as markers of, you know, human worth and, you know, self-worth and value.
Yeah. And you've obviously done a lot of work in this area, on yourself. and whatnot. One thing that you're talking about recently that you've been doing that I think is in part a response to this, which I love, is being in your meadow area.
Yeah.
Can
My
you tell
meadow
me
area.
about what it means to be in your meadow area? I think I'm in the meadow area right now, but I want to hear what it means to you.
Yeah, if you think about like, I don't know, I think about meadows as like frolicking, right? Like, oh, look, I'm just gonna like skip and hop through a meadow and have a picnic and like
Yep.
enjoy some brie and figs and pick some flowers and rest and nap. Um, and so, I wanted to really be able to focus on not over planning. That's really what it means. Just it's like, okay, I'm not gonna like try to reach these goals in my career or income or, life benchmarks that I have always used to like judge myself.
Mm,
They were goals, but they were also like excuses to self-flagellate when I didn't
mhm,
meet them. And so it's really just being more open to whatever comes my way and more receptive to just opportunities that arise rather than like hustling and grinding and trying to chase that down. And I think what I've discovered in this time is like I've done so much growth this year, relationally, attachment wise, just healing my own childhood trauma stuff. Like
mm,
all this stuff, it tends to be pretty invisible, and I feel it every day. But I think in the past there would have been a lot of shame around like, well, it's a waste of time or a waste of your energy if you don't have something to show for it on,
mm,
in terms of a accomplishment or an output, and really making peace with, okay, well, this work is still work, right? This is still important in my sense of self and what makes me feel happier and
mm,
more fulfilled and more, aligned to myself, even if it's not outwardly productive or outcome,
mhm,
and really having to make peace with that. So, in terms of that, like my mental area has not been completely like peaceful. It's
mhm,
been a lot of internal growth. It's been painful and hard. It's just not been achievement oriented.
mm. No, I love that. You talked about another thing you talked about, which I liked, it was related to you went to I think you went to a presentation that you really enjoyed, and it had a really big impact on you, and it got me thinking about this conference I went to in June, called the Black Behavior Analysts Conference, and I went there primarily to interview folks and kind of about their experiences and whatnot. And a lot of them talked about some of the stuff I'm not going to ask about. Um, and so I was wondering if you could talk. You talked about affinity spaces and how those are really important. And I wanted to talk about what those are and how folks can kind of find them. And because it sounds like just it sounds like this conference was sort of that affinity space for Black folks in my field, just because of the experiences they shared about being at this conference compared to some of our big sort of flagship annual conferences were so different.
Yeah. I mean, all the mainstream conferences are going to be predominantly white. That's
Yeah,
just who is centered in our culture. And that is just what the population
yeah,
reflects as well. So
yeah.
affinity spaces are just places where certain elements of your identity is centered, whether it's, LGBTQIA plus or racial affinity spaces or any other elements of your identity that's not the dominant norm. It's an ability, it's a space where you can have the ability to connect with other people who you have assumed more in common with. You have more shared lived experiences. You don't have to explain, how or why things are different for you
Mm,
because of your lived experiences. And it's a place where you can also be a little bit more authentic. You can, speak your mind without being afraid of offending fragile ears nearby.
mm,
And there's definitely value to educating the mainstream, but a lot of times we're tired of that. We don't want to have to be educating
mhm,
or like be representing in all the spaces that we occupy. And that's one of the big pressures and burdens of being marginalized in any space is, if you're a white cis het male, like you get to have just the assumption of just relatability wherever you go.
Yep.
You get to be individual, you get to be Ben, because there's a lot of white cishet males, and that's cool. So, but when I show up, it's like, oh, it's the Asian psychologist. It's, I have to represent all these elements of the various communities that I'm an ambassador from.
Mm-hmm.
And that strips me of my individuality in a lot of ways as well. And that can be really exhausting. And that's also one of the reasons why people really mask themselves to, or contort to fit into the mainstream, or they hide
Yes.
parts of their marginalized identities that, are more invisibilized. They don't want to choose to have to be an ambassador in even more spaces.
Yeah. Yeah. I hear that a lot from the folks I've interviewed about that pressure to represent your whole culture and sort of identity, and how that just, well, really ruins the day.
It's just a lot of work,
Yeah.
it's just a lot of labor to have to feel the weight of that everywhere you go. And I mean, and also just like having to be palatable to, people who might take your words wrong.
Mm-hmm. Thinking about your just that one identity as being an Asian psychologist, I know there are a lot of there seems to be a lot more now, available for Black psychologists. I think just because they've done a good job of rallying together, and they do conferences. There's the Association for their ABSI, and there's there's recently now the Black School Psychologist group had a conference to do those sorts of things. Are there groups slash events and whatnot available for Asian
Yeah,
psychologists?
absolutely. There is an Asian psychology division in APA.
Mm,
And there's one for Latinx, one for Indigenous folks. So there's definitely cultural groups. But then when you look
mm,
at the percentage breakdown, it's still just like each of these cultural groups is like maybe 4% of the
mm-hmm,
entire field. So there's not as many numbers. And I think to be Asian is there's an additional layer of just kind of a lack of solidarity in this identity.
mm.
And it's interesting because I don't know, maybe this is a spicy hot take, but
No, no.
there's like some consensus, right? In, like the Black community, like racism was bad, it happened, and its effects are still impacting us today.
Mm,
But there's not that type of consensus in the Asian American culture, because
mm,
there's a lot of people who very much pander to whiteness, and they very much use their model minority identity and their white adjacency to move ahead in life. And this idea of like, well, if I stay palatable and on the good side
mm,
of those who hold power, then I will get to enjoy some of the benefits of that power. And that causes a lot of risk, because those are not people who generally believe in collective liberation, or
mm,
the rising tides all ships model. And then there's more people who tend to be, yeah, like, no, you're not talking about us, you're not including us when you
mm-hmm,
talk about these reforms or whatever policies. We are still othered when it really matters. And
mm,
so I think there's, I mean, certainly this exists in the Black community, and just all communities, this like spectrum of ideology and beliefs. But I think the rift is wider in the Asian community, and it's
mm,
also wider generationally. I think most of my parents' generation, most of these, first generation immigrants are very thankful to be here, and they're very like, yay, let's, adopt
mm,
all the dominant cultural aspects. It's assimilation or die, right? Like, it's really trying to like pander to whiteness as a means of
mm,
survival. And then, and there's people who are like, no, but this doesn't quite feel right, because you're
mm,
erasing so many elements of who I am in order
mm.
to make me palatable. So we just don't have that solidarity within our community.
The second secret word is model. The third secret word is affinity.
way that some of the other racialized communities do.
Something else has just got me thinking about, and this is I'm probably going to articulate this wrong, but is with the Black community. And this is completely from my own kind of white male, just learning sort of perspective, but that generally speaking, when we talk about Black folk in North America, um, we just talk about Black folks as Black folks. We don't talk about sort of, you know, unless there's, unless the individuals overtly do it themselves, or there's an obvious sort of like accent or whatnot. But we don't talk about sort of Nigerian Black folks. We don't talk about
Mm.
Botswanian Black folks, and so Cuban Black folks, and so on and so forth. Whereas with Asians, we tend to, I mean, in circles I'm in, we do tend to talk about, Japanese folks, Chinese folks, Korean folks, and so on. Does that kind of play a role in some way in terms of maybe the lack of solidarity, or in the way folks are treated, or is that even a thing? Like, why is that a thing that I know, and then I can talk about what country you're from, and I'm actually concerned with, calling you Chinese when you very, very well be Korean, because there's often a Korean Chinese confusion, at least in my neck of the woods with white folks. How does that kind of play into things, or does it?
Yeah, I mean, I think, it's one of the solidarity markers, but also like one of the complaints that I hear from my, Black colleagues is that there is, not as much acknowledgement of the different aspects of Black identity.
Mm.
Um, and I think that's like really when you're talking about something like
Yeah.
through a racial lens versus like an ethnic lens, right? Like, we are all racialized as this one group,
Right.
versus here's these ethnic identity markers. And I think, just historically with how US history carried out, like we did not immigrate here against our will as enslaved people, by large population. And that is something that is, an ongoing reckoning that this country is continuing to deal with. And that is oppressive and also uniting in some of those ways. But we don't have that. Like, people came to the US from different Asian countries because of so many different ways, right? Like some came in like the 1800s to build the railroads, and some came, there was like a period of like 80 years where there was no immigration from Asian countries because of policy. And then people came, after the 1960s. So I think that's part of it too, is most Asian immigrants came to this country in the past, 70 years or so, versus, hundreds and hundreds of years ago, where it's like generational descent of enslaved people. And so there's more ability to track your cultural lineage too, which is a privilege. I know a lot of Black people who feel very disenfranchised from their history and privilege because they were trafficked here. So, all of these are kind of double-edged swords, right? There's just pros and cons to all of it, because it is a connection to ancestry and lineage, and yet it's what keeps us from maybe having as much solidarity. But then on the other hand, you really see this within like white communities, when people give up their ethnic heritage to be white. They lose their, oh, my descent is Irish or German or whatever. There's like, oh, I'm white. And that is the cost of that power, privilege, and access, is disenfranchisement, but, in a more kind of like chosen way from your lineage and history. And that comes with its own sense of grief and loss too. And, because white people have the power, like a lot of them compensate for it by co-opting and appropriating from other cultures. So it's, I mean, this is
no, I know it's a rabbit hole. I love the idea that, well, I love the idea, but it's interesting, the idea that as a white person, I'm also affected by white supremacy
Oh,
culture.
absolutely.
Obviously in the way of just, well, maybe not obvious, but in the way that I would actually give up some of my other culture,
Mhm.
that's also still white, I mean, based, I mean, if Irish or whatever,
But it wasn't always white, right? Like,
mm,
white's a construct. It
right,
used to be Irish
yes.
or English or, whatever
Yeah, yeah, gotcha.
cultural lineage you once had. Yeah.
Yes, no. So I've gone from, being, the Irish, Italian, German person to the white guy, and
Mhm.
and
Mhm.
what that all entails, and then that creates a supremacy, because there wasn't white before supremacy.
Yeah.
Yeah. Hmm. So, I mean, you say you're not taking on new clients. You do a lot of work in counseling, but you obviously do a lot of work in anti-oppressive care and DEI and kind of some of these things. Can you tell me a little bit about kind of beyond your Instagram page, which I think a lot of people will know you from, kind of how you do that work, and maybe how folks can access you for that kind of work?
Yeah, so I do a lot of speaking.
Hmm.
I would love to do more keynotes and speaking engagements for corporate employee resource groups or
Hmm.
different affinity spotlight months. I would also love to do some facilitation and consultation with organizations. Me and another psychologist that I met through TikTok, Dr. Raquel Martin, we have
Hmm.
a new website out, which is anti-oppressivecare.com.
Cool.
We developed a workshop just based on the comments that we were getting from our followers who are therapists about just like the lack of true like anti-oppressive education they got in grad school. And so we have made that available to download. And we also offer ongoing consultation groups for people who want to just talk more about real life applications. Also, a great place to be able to book both of us to do a speaking engagement if you're interested. And I'm also just facilitating other virtual spaces and affinity groups. I have one coming up this fall with a DEI facilitator, former educator named Joe Truss, who I met
Hmm.
at that BIPOC Educators Conference, where we're holding a BIPOC affinity space for reclaiming our collective strength. So that's going to be ongoing for this next year. And I'm always just kind of dreaming and developing new content and workshops that I will hopefully be able to roll out in the next year. But sometimes people just want me to come and do content for their platform or their organization. I love doing that too. I think it's really fun to film content. I partnered with Headspace
Hmm.
um, on their app for
Yeah.
some expert series. So stuff like that is
Cool.
all super fun for me.
So obviously your Instagram, then we've got antioppressivecare.com. Any other places folks can find you?
Yeah. So drhanren.com is where you can
Hmm.
find the majority of my stuff. And if you're looking for clinical care in the state of Texas, Pivot Psychology ATX is my group practice website.
Amazing. Well, Dr. Han, thanks so much for coming on. This was really cool.
Thank you so much for having me. What a wide reaching conversation we had. It was really fun.
Absolutely. Great. Thanks again.